Hi, my name's Kate Boddy, and I set up a campaign called That Deaf Health Injustice. My parents are deaf, and I work as a sign language interpreter. In my campaign work, I focus on encouraging companies, agencies, public bodies to reflect and to think about how they can improve their services for deaf people. So I focus a lot on NHS, ICB, private healthcare companies, and commissioners. And throughout my work, it's just got me thinking. So I'm encouraging them to reflect. As interpreters, do we need to reflect more? Unfortunately for us, we work in an environment where agencies who've been convicted of fraud are providing interpreters at court. Do we need to scrutinise agencies more before we agree to working for them? I often see chats asking, who's this agency? Does anybody work for them? What they're like? And there's a focus on terms and conditions. Do they pay on time? Which is fine because we don't want that race to the bottom. But do we need to focus more on quality? Questions do we need to ask ourselves and ask others? Do we need to ask, well, what type of service do you provide for deaf customers? Are you easily accessible to a deaf customer? Do you send them booking confirmations? Do you ensure you've booked the most appropriate interpreter for them rather than the interpreter who replies first or is the cheapest? Do you comply to the AIS? There's so many more questions we need to be asking than do they pay on time? How can we, as an interpreting community, work together to push that narrative forward? Cheaper doesn't mean better. And actually, now we've got more protections under the Procurement Act 2023, which focuses on a need to procure to agencies who are not just the cheapest, but provide the most social value and benefit. Let's work together. Let's push this narrative further and let's try to make sure the better quality agencies are winning those contracts. Together we can.